Welcome to today's video on a nail pathology. It is an important clinical sign to diagnose or getting some ideas about the disease. First is clubbing. Clubbing is a this is a clubbing. Clubbing is a bulbous enlargement of soft tissue of this terminal phalanges, and it increases the curvature of nail. It is occur due to edema and dilatation of capillaries. So main mechanism for causing clubbing is first is hypoxic theory. It is when AV fistula causes increasing blood supply to finger and decrease in toe leading to hypertrophy. Other mechanism like ferritin increasing theory, neurogenic theory, and hormonal theory. Grading of clubbing. First first grade is a fluctuation of nail bed. Second is obliteration of angle, that is Lowy-Brown angle. This is a Lowy-Brown angle. This is normal. Normal is 160 degree and abnormal is more than 160 degree. It is found in a mostly clubbing. So third stage is a parrot beak or drumstick. Fourth grade is a hypertrophic pulmonary osteoarthropathy. In this, pain and swelling at wrist is present. Now, main causes of clubbing. So, causes is divided as pulmonary causes, mostly occur in lung cancer, bronchogenic lung cancer, and mesothelioma. Other other lung diseases like abscess, bronchiectasis, and long-standing TB and diffuse fibrosing alveolitis. In cardiac causes, cyanotic congenital heart diseases, infective endocarditis is a is, this too is a main cardiac example. In other, cirrhosis of liver, Crohn's disease, and ulcerative colitis. It is a other example for clubbing. Also seen in hereditary cases, in idiopathic cases, and in acromegaly. This is a second image. It is a Aldrich Mees line, mostly seen in poisoning, that is arsenic. Other pterygium. This is a pterygium. Pterygium generally found in a lichen planus. It is an important photo. Oil drop sign. This is oil drop sign, generally seen in a psoriasis. This is a thimble nail sign. This is a thimble nail. It is a horn nail. Horn nail generally found in a trauma patient and fungal infection. And this is a Terry's nail. Terry's nail. This Terry's nail generally found in a pemphigus patient in dermat. Bees line. This is a bees line. Bees line is generally seen in a psoriasis patient, Raynaud phenomenon, and zinc deficiency. These three is a must-know example for bees line. And last is a Coleonychia. It is a spooning of nail. This is a concave and hollow in nature with thin edge, depressed center. Mostly manifest in a first thumb, then other thumb, in clubbing, manifest first in a finger, then in a thumb. It is a then thumb. So the example. So spooning of nail found in a iron deficiency anemia and Plummer Vinson syndrome. So if you found this video helpful, do not forget to like, share, subscribe to channel. Also let us know in a comment what topic you want next.